So did you fail your NCLEX test and you're not sure what to do about it? Feeling like you tried everything and you still haven't figured it out? Well, stay tuned and I'll show you exactly what you can do differently the next time so you can pass it. Now, for a lot of test takers, you can take the exam so many times and you'll still be in the dark about what you're doing wrong. That's because each test is graded separately. So for example, when you take the test, and let's say you take the test and you don't pass your exam, right? When you get your test results, it actually doesn't even bother to tell you what questions you got right and wrong, right? So you don't exactly know, especially when you took the test, and maybe you're the type of person where you go back home and you write down all the questions that you remember that you took that day, and you don't even remember, did I get that right? Did I get that wrong? I wasn't sure. That was a SATA question? Did I do better in SATA or less or worse than SATA questions, right? And so that's one of the issues for a lot of people, is that when they take the test and they get the results in the mail, it doesn't tell them what they got right and what they got wrong. Another thing too is that now each test is always independent of each other. So what that means is that you're not going to get the same questions every single time you take the test. So it's not as if the NCLEX is going to be like, oh, you were here before, let's go and give you this type of test instead, or these type of questions instead. No, each test is graded separately and totally different from one another. This is why I often tell students that when they're taking the test and they get the results in the mail, you can't necessarily say, okay, oh, I took test A back in April, and now I just took test B in November, and the results are kind of different or the same. You have to go back based on the most recent test that you took. You can't necessarily say, okay, the test April in A is the same as test April in B. It's not, right? But the only thing you can gather from looking at both exams, if you took in the test more than once, is if you're improving or if you're not improving, right? So this is one of the things, is that unfortunately though, when you're taking the test, it does not tell you if you did better or worse between each of the exams, and it doesn't change based on which test you took last. Now, another thing about the test too is that the report obviously is very vague, right? So meaning that when you get your test results, it's not going to tell you, it doesn't necessarily tell you exactly what the results mean, right? What it says instead is that it gives you near passing, right? You got above passing in this category or below passing in this category, right? And so the reason why they use that type of language is because when you're taking the NCLEX exam, the NCLEX is based on a very specific type of line, which is called the minimum passing. It's like a minimum passing line that the test grades it based on. And so in order to pass the exam, you have to get above that line the majority of the questions, which causes you to pass your test, right? And so when it says you're near passing, below passing, or above passing, it's talked about that minimum passing line on the test. How close were a specific group of answers to that line? Was it near passing? Was it above passing? Or was it below passing? Very far below, right? So this is essentially what it is. And of course, once again, you don't know where the line is, right? You don't know the exact information. All you can go off of is the fact that you got near passing in one area, below passing in another area, and then above passing in another area, right? So here, what do we do with this situation, right? Because it can feel discouraging. It can feel sad, especially if you were hoping to pass your exam and unfortunately the job that you were supposed to rely on, right? They found out you didn't pass and you lost the job, right? And so now you're either stuck as a CNA or you're stuck as a medical assistant, or you're doing some type of job that you don't even really like doing and you didn't even go to school for it, and now you're stuck in this position and you feel so uncomfortable, and oftentimes you may feel embarrassed or humiliated, right? So now what can we do though so that we can ensure that the next time is the last time, right? So here's one of the things that you have to realize when it comes to the test. Now, that unfortunately, like I said, it can't give us the answers, but what you can do is that you can look for patterns. All right. So what do I mean by this? So one thing I've done, and I've noticed now over the years, from working with so many people and seeing so many tests, is that there is a correlation with people's results. What do I mean by this? So what I mean is that people that take the exam, for example, and get 75 questions on their test and don't pass their exam, there's usually a specific type of category that they fall into as a test taker, versus people who get, let's say, all the way to the very end of the test and still don't pass their exam, now they're in a very specific category. So for example, for most people, not saying it's every single person, but for most test takers, what I've seen is that when they take the test and they get all the way to they get to only 75 questions and the test cut off, they were doing on the lower end or the worst end of the exam, meaning that they weren't doing so well. They were doing actually very poorly. This is what I'm mostly seeing, because remember, the test is trying to see if you are competent enough for them to give you a license, right? So if you're not able to answer what it determines is the minimum number of questions, it's going to fail you earlier in the exam than later, okay? So essentially now what that means then is that you probably need to honestly work on content review, okay? That's usually what it means, is that you need to focus more on your content. Because think about it, if I ask you what 2 plus 2 is and you say 5, and then I ask you what 6 plus 6 is and you say 10, right? I don't have to keep asking you questions to know that you're not really doing that great with math, right? So you have to honestly go back and study and learn more about math. You have to better understand the content. It's not going to be a matter of critical thinking or test taking strategies. It's going to be a matter of your content, right? So you're going to have to focus more on content. Now, however, though, people that get into the all the way end of the test, right, and they get 145, the maximum number of questions, right, depending on the time you watch this video, what I've seen with them is that they were so close, right, so close to passing their exam, but the exam didn't determine that it was enough above the passing line. So as a result, the exam did not pass them. So with these types of test takers, you need to work more on your test-taking skills, your test-taking strategies, your critical thinking skills, right? It may be a little bit of content, but it's mainly going to be your critical thinking that's going to put you over the edge. And you have to be conscious of how soon you take the test the next time. Otherwise, you're going to find yourself in a situation where you're taking the test over and over and over again, because it all matters. Now, according to the NCSBN website, if you go to the website right here, what you can do, you can go on their site and you can download one of their test plans, and you can learn more about what exactly is on the test, what exactly are each of the categories covered on the test, and that will help you to be on a better right track, so that way you know essentially what are the content you need to study if you fail with the minimum amount of questions. And then you can also learn more about the test taking strategies, which is going to be more about your critical thinking, right? So now here's the thing I'm going to offer you today, is that if you want me, let's say you feel like, oh, you know what, Nurse Chioma, I need help with this. I can't do this on my own. Can you show me the ropes? Now, what I'll tell you is that what I can do, no guarantee, is that either myself or one of my team members will actually look at your latest results and diagnose it. Or in better fact, we can have you take one of our exams for free, but then you have to pay for the consultation, so that way we can talk with you and learn more about yourself and identify what exactly you need to do differently so you can pass your exam, right? So what we'll do is that we'll learn who you are, we'll get an accurate picture of where you stand, and give you the best solution so that way you can pass your test the next time. Now, if you want something like this, then make sure you check out the link in the bio, the description below, so that way you can take advantage of this. Now, don't just ask myself, right? Wait, I've been doing this now for so many years, and we've gotten so many video testimonials of people who have passed their exam over and over and over again with our help, right? So if you want to get this same level of success, right, then I want to encourage you today, go below, click the link below in the description box. There are limited spots. Let me repeat, there are limited spots, right? Because we only have so much time that we can offer you throughout the day, throughout the week. So what I want to encourage you right now is click below. Time is running out. Go to this link right now on the screen and go to the link right now, so that way you can be able to book that consultation and get your life back on the right track, right? Get your life on the right track. Begin to learn what you need to do so you can pass. And like I said, we can help you to get to that next level. Now, if you're not sure that you want to talk, right? Maybe you're a high introvert and you know what? I'm not sure about this, right? And you're not certain. That's okay. Go ahead and hit the follow and subscribe button right now on the channel so that way you can get more content like this. And what you can do, you can click the link below, check out our assessment program, and where you can actually do the work yourself. Inside our assessment program, there you'll be able to learn exactly why you didn't pass your exam. You'll be able to better understand what your weak areas are. And I'll give you the content to teach you how to better focus and better understand the material the next time moving forward. So if you want to do the work yourself, then go ahead and click the link below to get our assessment program. If you want us to talk with you and tell you what you should do and tell you what will help you to improve, then click the link below to book a consultation. But until then, hit the subscribe button, follow for more, and I'll see you the next time. Thank you for watching. Talk with you soon.